I've heard of some, but I'm not really familiar with that. I know there's some things in Congress actually.
There are.
It's been brought up.
The only things I know of are that they had to include the side effects. Now you see those alerts on the commercials, but then also there's supposedly more limits on the perks that they can offer physicians when they go to talk to the used to hear about the big bulk trips to the Bahamas. And there are caps supposedly now that they can offer physicians when they go to market their particular medication.
There has been some stuff, hasn't there, on misleading advertising. The famous or infamous doctor wasn't, gave the incorrect impression that he had expertise in talking about what was the drug out. Lipitor. And after congressional investigation, prior to it, they manned the commercials.
It's also a very called Farm Free. It's like more in college level. I don't know how much power they have in controlling the advertising, but they work really hard to limit the interaction that pharmaceutical companies have in medical schools because they really hit hard the young doctors.
The other thing medical schools do not do, in my opinion, a very good job at is teaching the doctors to ask questions about somebody's ability to pay for medication or, it's one thing to just treat them and prescribe something, but if they walk out the door and can't afford to get it, you kind of fail at your job. But doctors are not taught to ask those questions. They're taught to set up their policy so that somebody uninsured may not be able to get an appointment with them. But once they're in a door in an emergency situation, they're not trained to ask, can you actually take the medication you're prescribing? Which I see as
And one part of that is people don't know how much they cost. If I'm getting sick and I'm in the emergency room and I feel really bad and you say, go take this, I'm going to the drugstore to get it. If I feel terrible. Now when I get there, then I have the shock that the medicine costs $10 a piece. And I don't have the money, but give me $5 so I can get through the night and I'll feel better. And once I feel better, then I won't take it anymore. Or I will save it because it's so expensive so that when I feel bad again, then I'll have some. And in the private doctor's offices, they have office managers. And so we're in such a, medicine is money. The doctors all have office managers. That's what the office managers do. Keep the money in, keep it streamlined. Unless they want to hire a nurse practitioner to give this extra teaching to do that. I don't think they're really concerned with that. Because most of them are in associations now. And if you go, and you're in an association, because I'm at one in Akron General, it's about a 15 to 20 minute limit. Otherwise, you're not productive to the group practice if you take too long. And so it's got to keep on moving. So then they have all these other people who want to have a prescription. You just call and go through the voicemail. It's not you get to the Walgreens. Now you know to ask ahead of time, and they will tell you look it up. Some people don't have all that mechanism to do that.
Which also brings up the point of when you don't have health insurance, people who don't have health insurance are much more likely to use an emergency room rather than going to a less expensive appointment in it. Because maybe you can't get an appointment, maybe you're not used to going through that process. So, as we've heard on the news, people are going to emergency room for everything. And things and use an ambulance sometimes, which again, just increases cost because they can't necessarily pay for these things and they have a much bigger bill than they would have had if they were able to go to a doctor as an outpatient and utilize the services in a way that the average person would utilize them.
Well, a lot of doctors want to see you.
Right.
Because they have a limit on how many Medicaid patients they want to take. When you go in these doctors' offices, the sign is there. Prepare to pay unless you've made previous arrangements. And then if you call them, they say, I'm not taking any more Medicaid, then what are you going to do?
Or if you have no insurance, and they won't take the medication,
might not seem like 20 minutes, but it's about 250 for the time cost.
If you're considering working for a category, which is a category that's mostly for the uninsured, that's a lot of money to shell out. So they probably wants for groceries, it's a good situation.
Kind of transitions as we can identify problems, issues are, so that's one of the possible solutions.
There's a possible solution, it is the solution. Like Amanda said, I'm a member of SPAN Ohio, it's a Single Payer Action Network Ohio. It's a nonpartisan grassroots organization devoted to the fundamental change of healthcare. The reason we're doing it on a state level, it's needed nationally, but the reason we're doing it on a state level is because in Ohio, the citizens can write a law and enact it. On the federal level, we have to wait for the politicians, our elected representatives, to get the law passed. House Bill 676, written by Conyers and Kucinich years ago, has been sitting and waiting for the politicians in Washington to pass it, and they haven't done it. If you look on their websites, if you go to opensecrets.org, you'll see where they get their money from. They get their money from insurance companies and pharmaceuticals. They're not going to kill the golden calf, you know? They're just going to keep on taking the money and look out for their interests. But on the state level, we can write our law, and we have written a law. It's called the Healthcare for All Ohioans Act. It's been introduced in the legislature by friendly politicians, Mike Skindell and some others in the House, and most recently by Dale Miller in the Senate. But again, it's not passing in either house. It's not even getting a fair hearing because there's too much money against it. So we also have an initiative petition going. And the way the law is in Ohio, citizens can either write a constitutional amendment, which requires about 300,000 signatures, and then it goes on the ballot at the next general election for the people to vote on, or an initiative petition, which is what we have, and we need 10% of the people who voted in the last gubernatorial election, about 120,000 signatures to get it in front of the legislature. The legislature then has 4 months to either pass it, amend it with our approval, or reject it. In the event that they reject it, we have 90 days to go out and get an additional 120,000 signatures, and then they have to put it on the ballot in the next general election. So we're doing this from two different angles. We've got it already introduced in the House and the Senate, but we're also working on the initiative petition. We're close to 100,000 signatures already. Of course, we want to have a push. You go in with 120,000. They find one wrong and you're not there. So we'd like to go in with 200,000 if possible. And that's why we're doing it at a state level. Now, what SPAN is, the Healthcare for All Ohioans Act is, essentially everybody in the state of Ohio is covered from conception till the time they're put in the ground. No questions, no ifs, ands, or buts, you're covered. What I'd like to do is just read a short excerpt from the summary of the bill. It says the proposed law establishes the Healthcare for All Ohio, establishes the Ohio Healthcare Plan, which will provide all qualifying Ohio residents and all qualifying persons employed in Ohio with coverage for inpatient and outpatient hospital care, preventative care, mental health, vision, hearing, prescription drugs, dental, emergency services, rehabilitation services, hospice care, home care, health maintenance care, medical supplies, necessary transportation for covered health care services, and all other necessary medical services as determined by any state licensed, certified, accredited, or otherwise authorized provider. So essentially what this does is it gets rid of the insurance companies. Now the state becomes the single payer insurer for all of our citizens. Now, we were listening before, we know that insurance companies are a big part of the problem. Almost 30 cents from every healthcare dollar that we pay goes to their administrative costs and profits. When we wipe that out, we have a lot more money to deal with healthcare. The General Accounting Office and the Congressional Budget Office have both looked at national single-payer plans, and they've come to the conclusion that what is currently being spent on healthcare in the United States, which is $2 trillion now, we could cover everyone, fully cover everyone in the United States and have money left over. All we have to do is get rid of the insurance companies. Again, we can't do that on a national level on our own, but on a grassroots level, we can make it happen in Ohio. And that's what Span Ohio is doing. We've got this petition drive going, and we need to collect signatures. Personally, I've been involved. 2 years ago, I walked around Ohio, took 3 weeks vacation, walked 600 miles, talked to people, did interviews, did all kinds of interactions, and got some publicity. I plan to do it again this year. It'll be another 600-mile walk. I'll be leaving Cleveland, going east to about the Pennsylvania border, then south down to through Appalachia and back up to Cleveland. It's about 20 to 30 miles a day. When I got involved with this to begin with, though, it was like the professor said before. My thought was that if you needed health care, get off your lazy butt and go get a job. I didn't realize the depth and width of this problem. It's amazing how many people are uninsured and underinsured. That's the biggest problem, is the underinsured. If we look at the Massachusetts plan, which is one of the state solutions, what they've done is they've instituted mandates in Massachusetts. So people who before didn't have to pay for health insurance now have to pay for health insurance. They have to pay a premium cost or share in the premium cost for a high deductible health care plan. Now that's more money coming out of their pocket. The problem is, with this additional money coming out of their pocket, when they go to use their high deductible plan, they don't have the money for the deductible. So they can't use the insurance. They're not getting health care. All they're getting is health insurance. We don't need that solution. What we need is health care. It's real simple. We face a lot of challenges getting this done. Obviously, the insurance companies are going to lose money. In Ohio alone, we spend $72 billion a year on health care. $72 billion. Half of that's already being paid by the federal government. Medicare, Medicaid, veterans, government employees. So all we had to raise for Span Ohio, for the Healthcare for All Ohioans Act, is $36 billion. It's getting easier and easier to say $36 billion. It's great. And these purple sheets were on the table when you came in. Make sure you pick them up when you walk. On the back of it, where it has funding for the Healthcare for All Ohioans Act. Because that's something that everybody asks, okay? The first thing we're going to do is we're going to wipe out all insurance premiums. Nobody's going to pay for insurance anymore in the state of Ohio. So like right now, GM, Rick Wagoner says, for every car that comes off the line, GM pays $1,600 for health care for their current and their retired employees. Thanks, Rick. In Canada, the same cars coming off the line cost $600 because they have a national insurance program. So what this will do is, in Ohio now, GM will no longer have to pay for health insurance. Walmart, and with a little bit that they pay, Pizza Hut, McDonald's, the neighborhood dry cleaner, all these folks that don't currently pay for health insurance are going to have to start contributing some. At the bottom it shows that there will be up to a 3.85% payroll tax paid by all employers. So it's leveling the playing field. It's no longer going to be the Giant Eagles of the world or the Costco's facing a fight against Walmart. Because Giant Eagle pays for health insurance for their employees. Heinz pays for health insurance for their employees. Walmart, until very recently, didn't, and what they're paying now, they might as well not even bother. So all of a sudden now, they're going to be paying the same amount as Giant Eagle. There would also be up to a 3% gross receipts tax paid by all businesses. Now, one of the savings on this is going to be with governments. Because currently governments big part of their expense is health care for their employees. Up to anywhere from 10 to about 18% of the personnel budget for government office is health care. So their payroll would go from a 10 to 18% health care to a 3%. The governments don't have gross receipts, so the government isn't going to have to pay that. So the city of Akron now is going to save a whole bunch of money. They'll be able to fix some of the roads. I don't know if anybody noticed it coming in today. I sure did. The police, the fire, the emergency and medical services. They'll have all kinds of money for this because they're not going to be putting it into health care for their employees, and their employees are going to have health care. It's at least as good as what the elected officials get, if not better than what they currently get right now. Because understand, under the Healthcare for All Ohioans Act, there are no co-pays, there are no deductibles, we don't care about pre-existing conditions, all it is health care. Just everybody's in, nobody's out. Personal responsibility on this, going through the text, and I'll get back to you in a second. The next line is 6.2% on individual compensation in excess of the Social Security cap. This year, looking at the sheet, the cap for Social Security is $102,000. So you pay Social Security tax on 100% of your income up to $102,000. After that, you stop paying Social Security tax. So most of us pay Social Security tax on 100% of our income. People who make $200,000, $300,000, $400,000 a year only pay Social Security tax on a fraction of their income. Again, what this will do is, when they stop paying the Social Security tax, that money will keep paying the tax, but instead of going to Social Security, now it'll go to the Healthcare for All Ohioans Act. And anybody who makes over $200,000 a year will pay 5% on adjusted gross incomes over $200,000. The last line, the funds from other government sources. What we hope to do, and of course we can't do it until it's enacted, is, remember I said we're already paying, the federal government's already paying $36 billion a year for health care in Ohio. What we'd like to be able to do once this law passes is go to the federal government and say, look, give us the $36 billion and go away. Just give us the money and leave. So that instead of somebody going with Medicare, going up in Medicare being the first payer, and then Healthcare for All Ohioans Act picking up the difference, would you ever, simplify everything? Just one card pays it all. Failing that though, the way it would happen would be Medicare would cover their part, and then Healthcare for All Ohioans Act would pay the rest. So obviously now, Medicare D, somebody would be foolish to buy Medicare D because it's already going to be covered under this. You had a question or a comment? I can go on forever, but
I had a few questions. One, you mentioned prevention, and I think that is pretty much should be our first line in terms of healthcare. But it oftentimes now health plans don't really provide any coverage for prevention. What do you know right now? Like what would be written into this healthcare plan for people who get all their regular checkups, who work out regularly at a health club or any of the other things that are preventive? What would be written in to assure that people have money to do that? That's my first question.
Yeah. Well, the thing is, the law is not going to mandate that anybody participate in any insurance, gym membership or anything like that. The law has already been written. It's 36 pages long, and you can see it online at the website if you want to read the whole bill. All the language is there. But what the bill does is when you go to the doctor, it's paid for. It's covered. It's not a matter of I don't have the money to see the doctor. And that's one of my problems right now. If you think back in the 70s and 80s, the HMOs were going to save us. Health insurance costs are going through the roof. and the HMOs are going to save us. And that didn't quite work out. So then the PPOs in the 90s were going to save us. That's, people don't like HMOs, they don't like the restrictions. So we're going to do the PPOs and give people a little bit more flexibility, but we're still going to be able to control costs. And that didn't work out so well. And now we've moved to the health savings accounts. That's what's really going to control the money, because now people are going to be invested in it. And what happens is people don't spend that money. Okay, when people have a headache for a day or a couple of days or a couple of weeks, they wait for it to go away rather than spending the money from their health savings account. Which means that possibly that tumor that's giving them the headache is continuing to grow and going undiagnosed. And when they finally can't stand the pain anymore, then they go in and get it checked out, and then it's too late. So what this does is it's not going to cost anything to go to the doctor and get it checked out. You may go to a nurse practitioner and get it checked out. You can work through your doctor's office in a bunch of different ways. The problem right now in this country is when kids, I shouldn't even really call them kids, when doctors graduate from medical school, they graduate $125,000 to $200,000 in debt. And they have a choice to make at that time, whether they follow their heart and become a primary care physician, or if they go into a specialty where they can make more money. I'd like to find out where these offices are, where they limit you to 15 or 20 minutes, because most doctors in the Cleveland area are trying to get you out after 5 or 10 minutes, and it's for the same reason, because they've got they got to push it through and make the money. And under this, it's going to control the costs for the doctors, and it's going to enable people to get in for that preventative care.
Is there a cap on how many preventative visits or anything like that?
No, there's not.
There doesn't need, you have a relationship up with your doctor, with the doctor of your choice, and you can go to them and say, like it was 30 or 40 years ago, I have a family history of heart disease, and your doctor has the time and the ability to spend with you to say, we're going to look at your family history, do the appropriate testing, and we're going to set up a plan for your future. Those days are gone.
To get the pre-diabetic person before they actually develop the diabetes, and that's what I meant by prevention. Maybe health education classes, and not saying that going to the gym is mandatory, but if you do go, that too could be covered, or you can get a discount on it.
There's nothing in the bill for that, for that type of thing. But again, with the prevention, like right now, my mom is 76, 77, I think. She's got osteoporosis. She's probably shrunk about 3 to 4 inches in the last year and a half. My sister, who's 56, her doctor wants her to get some additional tests beyond just the bone density. There's some further testing. Her insurance doesn't want to cover it. That would be covered under this because, like I said, it's preventative medicine. But her insurance, her and her employer are paying probably $10,000 or $11,000 a year for, isn't getting her covered. So that's the big thing, is the preventative care. That's going to control a lot of the costs. Like the professor was saying before, people come into, and I'm from Cleveland, Metro Hospital. They get rated. They go in there for their care. And what happens is that a lot of the cost gets rolled into the general overhead. Families USA last year did a study that said that $900 of every family insurance policy goes to cover the uncompensated care of doctors and hospitals. It's just rolled over into the other costs. Did you have another question? Okay.
And you can kind of roll this in. I wanted to know what happens to the insurance companies and their employees if this is enacted. What if this, catches like wildfire and all of the states adopt this? So then what happens to all of the insurance companies, their employees, and the economy? Because I do think that our economy is kind of dependent somewhat on our current healthcare structure. And then I wanted to know what
what any opponents to stand, what are criticisms of this plan?
Well, first of all, if you look at the Canadian healthcare system, it started in the Saskatchewan province. And actually, this Canadian system has 5 different healthcare systems that are covered by one set of principles, but they all have to meet, but each province has its own healthcare system. And that's exactly what happened in Canada. They did it in the Saskatchewan province, and it spread to the other ones. In this country, it's the same thing with any other social movement. The women's suffrage movement. That happened in Wyoming. And it happened in Wyoming because Wyoming didn't have enough citizens to become a state. Well, they figured out in Wyoming, if they gave women the right to vote, they would become citizens, and then they'd have enough citizens to become a member of the United States. So they did, and as a matter of fact, they had more votes than any of the other states because they had so many citizens. And then the other states went ahead and did the same thing. It wasn't quite as simple as that, but that's the short version. To your other question, if you look on the front of the purple sheet, the highlights, number 9, people who lose jobs as a result of this passing in Ohio will be eligible for up to $60,000 a year for 2 years. What we'd like to do, every doctor's office has at least one person who does nothing but billing. That's their job. To sift through all the different insurance paperwork and the doctor paperwork and come up with the right combination to send the bills. I've got Blue Cross right now, and that's my wife's job. She handles the insurance. But I go to the doctor, he sends a bill that says, do not pay because we're submitting it to your insurance company. Then I get something from the insurance company saying, your doctor has submitted this bill. Do not pay this. This is not a bill. Then I get something from my doctor that says, your insurance company has paid this much and we are resubmitting it for further payment. And I get something else from the insurance company that says, we are doing further processing. There's 10 or 15 sheets of paper before the bill's paid. So this is all going to be eliminated, and you're right, there's going to be a lot of jobs that are eliminated. And what we want to do is get those people out of the health insurance business and into the healthcare business. So, so there aren't going to be, we'd like to see more nurse practitioners, more PAs, more MAs, more people working in the facilities. And this will facilitate that by because it's going to give them up to $60,000 for up to 2 years. So that's 2 years of community college education, a 2-year degree. They could be X-ray techs, they could be LPNs, all kinds of things they can get in 2 years. And with $60,000, that gives them plenty of time to get it done.
You make an assumption
But they'll do it.
and that they want to do that. People, they're doing that because they like that. They don't want direct care. A lot of people they don't want to touch the person now. They don't want to do direct care. $60,000 sounds good at the moment. And some people may use that to pay up their bills, get the car note, and everything else. I don't know that is a good gesture, but I don't know if that's going to solve the problem to say go into health care or some other avenue. Because they like paper, and I agree with you about all the paperwork that goes, but they waste so much postage and paper and people that handle that. I don't think that's such a good idea.
Well, the thing is, I'm with the UAW, okay? And when I got involved with this, that was one of my concerns. It was like, there's a lot of people out here, I've got no problem, with the guy, I forget his name now, from United Health last year, that left with $13 billion, golden parachute. McGuire, yeah. I've got no problem with him losing his job, yes. But there's a lot of folks out there that help us every day under the current system. I didn't want to be a part of them losing their job. And I have seen a lot of people lose jobs, here in Akron with rubber and steel and Cleveland area with steel and with the automotive industry. And when these folks leave, when these jobs leave, these folks get 6 months of unemployment, and that's it. Maybe if they're lucky, they get some TAA benefits. And with this, if Ohio can be first, okay, I look at this also as an economic development tool. It's going to create jobs. Last year in Lorain County, Ohio, they closed the Lorain Assembly Plant. Okay, and the Lorain Assembly Plant, their main product was the Ford Escape. Now, Kansas City Assembly makes the same product. Okay, if this law would have been in effect at that time, Ford would have had a decision to make. Do we close the Lorain Assembly Plant, where we have controlled health care costs, or do we close the Kansas City Assembly Plant, where we've got uncontrolled health care costs? To me, it's a no-brainer. They close Kansas City and bring those jobs to Ohio. How many people do we have that are tied in their jobs because they can't leave because of the health insurance? How many places, if your daughter ever gets health insurance from a company, she's gonna have to stay there regardless. She hates the job because she's not gonna be able to get health insurance. She could have the best idea in the world, but she's not gonna be able to implement it because she won't be able to go out and buy health insurance on her own. My brother-in-law had a small electronics company. Did everything right. Did everything he was supposed to do in life. He graduated from high school. He didn't graduate from high school. Dropped out of high school. Got his GED when he was in the Army. Got out of the Army. Started his own business. Built the business up. He was ready to retire at age 55. Had enough money to retire. But he made a mistake. He got prostate cancer at 46. Got it cured, got it caught in time. Everything was great. But now when he wants to retire and go outside of his company and buy insurance, he can't get insurance anymore. He had to stay employed until he was 65 and eligible for Medicare so that he could have insurance. It's insane. He couldn't buy insurance for any price. It just won't sell.
Another element to your question that comes to my mind has to do with the nature of the distribution of money that goes into the healthcare system, which is more healthcare industry, which looks at healthcare as a commodity. And if you look at the dollar, $1 that's going in, and 30 cents of that dollar is being extracted by the insurance industry. Some of that, yes, is paid for people to manage the paperwork, and it's hiring people, but some of that is going for the very few at the top. Well, now, if that crowd is gone, and the CEOs and chief financial officers, I'm not going to shed maybe a few crocodile tears, but that's about it. But once those dollars are freed up, all right, yeah, there's going to be some that are working the blue-collar jobs that are going to have to figure out how to be redirected. But you have all those saved dollars now. And now if automobiles are cheaper, right, you're not paying to get a car, the healthcare costs, or if every product that we purchase now is cheaper in 70 cents because we're not covering the healthcare dollar, that means we have more dollars left over to spend in other things. That creates a super duper stimulus package that when you're starting to spend dollars in the system for everything else in the economy, well, that is going to create jobs somewhere else. So that will absorb easily, I would think, the jobs that are being lost in other areas.
Oh yeah, again, I'm a union guy. I'm all for work, but making work to push papers around. Again, that's like when we get into the health savings accounts. It's just another level of bureaucracy that the insurance companies are adding, because now somebody's got to track the money that I spend. They've got to track my savings account. They have to know when to kick in the high deductible plan that goes with it. It just keeps on building and building. And of course, the CEOs, the CFOs that Craig was talking about, all those folks work off a percentage of the income. So it's great. Costs just keep on going up, and the insurance company just keeps shuffling the money. candidates with their healthcare plans is they all keep the insurance companies in it. You know, and that's, so any of their plans are doomed to failure. You know, they throw stones at each other. I throw stones at all of them because none of them are going to work. The only thing that's been proven to work is a single payer system. You know, they talk about universal coverage. How do you get universal coverage? If I have to buy an insurance plan and the government makes me buy it by either fining me or taking my tax incentives or whatever, and I have to pay into that, and then when I go to use it, I have to pay again, I may not have health coverage. I may have part of universal insurance, but I don't have universal coverage. Universal coverage only comes when I can go in whatever I need to for whatever I need to go in for, it is covered.